how intimacy can thrive after major life changes like childbirth or surgery, plus secret tips to improve your time in the bedroom. That's next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Hello, Dr. Leah. Great to see you again.
Absolutely, you too.
Thank you. You know, people come up to me and assume that I know a lot about sex, that I'm on a sex talk show. And let me tell you something, I learn something every time on this show.
Well, thank you.
No, you're welcome. Thank you, as a matter of fact. And my wife thanks you as well.
All right.
Anyway, we have a ton of questions from wives and husbands and boyfriends and girlfriends.
Okay.
Are you ready for the first question?
All right, here we go.
Let's do it. Okay. First question says, a young lady asks, are sex toys only for internal or external use? Can you use them in the water?
Always start by checking the packaging information. It will usually say whether or not it's waterproof, especially because being waterproof will be a selling point. If it doesn't say it, assume it isn't.
Okay, what if it's water resistant? Is that the same as waterproof?
That's a good point. Waterproof and water resistant are not the same thing. If it's waterproof, it should be completely sealed and is meant to get underwater without damage. If something is water resistant, it's fine if it gets wet, but it's not meant to be submerged or used in a bathtub, for example.
Okay, so how would you clean a sex toy if it's waterproof or not waterproof? How do you clean it?
Well, there isn't much difference in how you would wash these sex toys, although you probably want to take out the batteries or keep the charging ports away from water, and you just want to be careful. Look to avoid running water around those parts. If you're unsure, usually the manufacturer will have some guidance on how to keep them clean.
Great answer, thank you. We have a question from a young lady. Says, my vagina always gets sore after sex. Is this normal?
If you're feeling discomfort after sex, it's easy to assume that things may have just gotten a little bit intense. While some people enjoy rough sex, that causes some level of discomfort under most circumstances. Your vagina shouldn't hurt after or during sex. Sex should feel good and be pleasurable. When it's painful, it's important to let your partner and your doctor know. Unless it's your first time, it isn't really normal to feel that sore after sex.
So is the soreness that this viewer is experiencing, is this common?
Well, a lot of women deal with pain. It's estimated that 3 out of 4 women deal with pain associated with sex at some point in their life. Most of the time, the pain will be temporary, but sometimes the issue can be chronic.
And what would be some of the reasons for this pain, soreness?
Well, there are several reasons. One reason could be that there isn't enough lubrication. While this makes sex less comfortable, this can also lead to tiny tears in your skin, making you prone to infection and discomfort. The fix for that is using enough lubrication.
Are there any other reasons they can think of?
Having sex when you're not aroused can also lead to a lack of lubrication and soreness. If this is the case, try more foreplay next time. Meanwhile, applying a cold compress and taking a break can help. Another cause for soreness could be deep penetration. To feel better, a warm bath might help, or using an over-the-counter pain reliever like an NSAID. Women who have low estrogen might experience inflammation and dryness, causing soreness. There are some vaginal moisturizers that can help with that. And there are medical conditions that could cause soreness, like fibroids, vaginismus, cysts, etc. With any of these, talking to a doctor will really help. A common condition that affects these is endometriosis. It can cause pain before, during, and after sex. For more information, check out what this doctor has to say.
Hi everyone, I'm Dr. Megan Wasson, a minimally invasive gynecologic surgeon and chair of the Department of Medical and Surgical Gynecology at Mayo Clinic in Arizona. Endometriosis is a condition that affects approximately 1 in 10 reproductive aged individuals. It occurs when cells similar to the lining of the uterus, or endometrium, grow outside of the uterus. During a menstrual cycle or period, this tissue responds to hormones and frequently results in pain. Endometriosis is most frequently seen in the peritoneum, or the thin tissue paper lining of the pelvis. It can affect other pelvic structures and result in endometriosis-filled cysts on the ovaries. These are called endometriomas. They can also cause scarring of the fallopian tubes. The diagnosis of endometriosis begins by reviewing the symptoms an individual is experiencing. This includes the location of the pain, factors that make it better or worse, and other symptoms that may be present. Next, a pelvic exam and imaging may be recommended to further evaluate the pelvic structures, including the uterus, ovaries, fallopian tubes, bladder, and bowel. Advanced ultrasound and MRI are used to provide a thorough evaluation for deep infiltrating endometriosis. A pelvic exam and advanced imaging may further raise the suspicion for endometriosis and give insight into the extent of disease. But to definitively diagnose endometriosis, surgery is required. This is most commonly performed by laparoscopy. While the patient is under general anesthesia, we insert a camera and surgical instruments into the abdomen through small incisions to evaluate for any areas visually concerning for endometriosis. Any tissue that looks like endometriosis or is in an area we frequently find endometriosis is removed and examined under the microscope to confirm the presence or absence of endometriosis. Regardless of the location and extent of endometriosis, full removal of the disease provides the best opportunity for long-term symptom improvement.
She mentioned like the diagnosis includes looking into the symptoms. What would be those symptoms besides pain?
Other issues could include digestive issues, bleeding and pain, can even extend to other areas of the body like the back. But looking at the symptoms is one part of it. Imaging and surgery are likely necessary.
Great, thank you for that answer. Next question. A viewer says, I saw mints that increase saliva production. How does that work, and does it help with sex?
Yes, sucking or chewing on mints can increase saliva production. The act of sucking or chewing signals to the digestive system to start producing saliva.
Now, this might sound like a dumb question, but are there different types of mints and they have different effects?
Not a dumb question at all. Mints with flavors like citrus, cinnamon, and mint can be good choices as long as they're not too acidic or irritating. Some mints also contain ingredients like xylitol or aloe, which can help with hydration. Keep in mind that sugar-free mints can help with a dry mouth, but they can also change pH levels in your mouth. Maintaining a healthy saliva flow is important for overall health, including sexual health. Adequate saliva can make oral activities more comfortable and enjoyable, and it can help prevent dry mouth, which can be a side effect of certain medications or conditions.
The reason I asked that not so dumb question now that you answered that, thank you, is because on social media you see a lot of advertisement for these mints that give you special results. Are they legit or?
Well, there's a thing called Flint's mints that are specifically designed to increase saliva production. They're made from a flower which has been used by Amazon tribes for centuries to activate saliva glands. Flint's mints can cause a warm, tingling sensation and increase saliva production, which can be beneficial for those experiencing dry mouth.
Are there any other candies that maybe CBD would maybe?
I'm not sure about the CBD candies. I haven't read any research on that. I actually have a friend of mine that worked in the sex industry who swore by Starburst. I have no research on this whatsoever, but she worked in the industry and she jokingly said she leaves them by her bed in her social life all the time. Full pack of Starburst.
So when you say she works in the sex industry, what does she do?
She was famous in the porn industry.
Got it, okay.
Yeah.
So Starburst. So
and she always joked about Starburst.
Get your Starburst, people.
Yeah.
Okay.
So that's what she said. So I don't know. I've never tried it.
Okay.
But, hey.
Dr. Lee, our next question from a viewer. Ask, are there classes that help you become better at sex? I've seen some on TV shows, but don't know if they're real.
Unfortunately, sex education is limited to the basics, so it's natural to have questions and want a little more information. There does seem to be a growing trend of more comprehensive courses for both in person and online. These types of classes are designed to provide practical knowledge to enhance intimacy and address various aspects of sexual health. They can cover a wide range of topics from understanding anatomy and exploring pleasure to learning communication skills and addressing specific concerns like pelvic floor health.
These classes can be online as well?
Well, yeah, there's one called O School, and they offer different workshops with sex educators, coaches, and doctors. Some class topics can be like sex toy cleaning, pelvic floor health, and even sex with disabilities. The best part is they're free. There's another company called Love Honey that makes sex education videos. Although when looking online for this content, you want to be careful what you're searching for.
Yeah, you don't want the Love Honey on your computer. And also be careful, even on incognito, your employer can still look up what you saw, so it's not always safe. So
see, I actually didn't know that, but since I do a lot of research and sexual behavior, and I do it at work, occasionally there will be something that comes up like, explicit content, and I'm just thinking like, oh God, the people that are tracking our computers, I can only think what they think of what I'm doing, whether it's looking at articles for this show or for other publications. I haven't been flagged yet. At least it's all been legitimate. There we go.
We have a question from a viewer. Will sex feel good if I pursue gender-affirming surgery?
Studies do show that people who have gender-affirming surgery often experience increased sexual satisfaction. One reason is the reduction in gender dysphoria. When their body is aligned with their gender identity, it can make for a more positive sexual experience. It might feel better too. One study found that 65% of women had more pleasure. Another study found that about 37% of its participants had better orgasms. Sensitivity can also improve too, so there are a lot of potential benefits. However, the type of the procedure might have an impact. You should be able to go over the options with your doctor and cover the possible effects.
Okay, so there's also a mental part of it and a physical part of it.
Yeah.
So that as long as they both align, and that's great.
Yeah.
Awesome. Thank you, Dr. Leah. A viewer asks, I love my husband and want to be close to him, but I am nervous about getting intimate after childbirth. What can I do to feel better about it, Dr. Leah?
With your attention and your body devoted to your newborn, finding time and energy for your partner can be challenging. However, postpartum sex is a hurdle most couples face. And while it may seem daunting for now, it won't be forever. Make sure you are ready for yourself and make sure you get the clear from your doctor. Most providers recommend waiting several weeks to allow your body to heal and reduce the risk of complications. Typically, you'll have a postpartum checkup between 4 to 6 weeks after delivery. During this visit, your provider will assess your healing, check for postpartum discharge, and address any concerns you might have. If you've had stitches from a tear or episiotomy, your provider will ensure that they are healed sufficiently. Remember, it's okay if you need to wait longer. Some studies show that as many as 40 to 80% of women deal with sexual dysfunction postpartum within those first 3 months. So there's no normal timeline. Go at your own pace.
There's a lot happening in postpartum. Can you walk us through the changes that might impact sexual health?
Well, pregnancy, childbirth, and the postpartum period involve significant hormonal shifts, which can impact your sex drive. The hormone progesterone, which supports fetal growth and milk production, can reduce your sexual desire as your focus shifts to the baby. Fatigue from breastfeeding can also disrupt sleep and can also make intimacy kind of seem overwhelming. Body image can also affect your desire. Extra weight, sore breasts, and any scars from a C-section might lead to self-consciousness and even shame. These hormonal and physical changes take time to adjust, especially if you're breastfeeding. If you experience symptoms of postpartum depression like mood swings, sadness, loss of appetite, social withdrawal, low self-worth, or thoughts of self-harm or harming the baby, seek help from your healthcare provider immediately.
If our viewer feels discomfort, what can she do?
Well, hormonal changes can cause vaginal atrophy, leading to thin, dry, sore, and inflamed vaginal walls. This can lead to pain during sex, especially if you've had an episiotomy, or tear during childbirth. To alleviate discomfort, have more foreplay. Use lubricant to combat vaginal dryness and communicate with your partner about your readiness. Childbirth can also stress your pelvic floor muscles, potentially leading to pelvic organ prolapse or urinary incontinence, or reduce vaginal sensation. Kegel exercises can help tone these muscles, and pelvic floor therapy may be beneficial. If the pain continues, as I always say, talk to your doctor.
Can you think of any other considerations, Dr. Leah?
Well, know that it's also possible to get pregnant soon after giving birth, even if you're breastfeeding. So to avoid conceiving too quickly and increasing the risk of complications, discuss birth control options with your provider. Methods like condoms, IUDs, and prescription pills can help you plan for a safe interval in between pregnancies. Experts generally recommend waiting 18 months with a range of 12 to 24 months before trying to conceive again.
You know, you know a lot. You have any tips for rebuilding intimacy in this situation?
Get a babysitter.
Get a baby.
That is going to be my biggest tip. No, I can say this just in friends. I've got a lot of friends with young kids, and the ones that have babysitting grandparents, whatever it is, the majority of the time, I can see the intimacy levels is just greatly different when they have extra help, especially when that help is free. So, you know, give yourself some grace, especially if you're a new parent. You're taking on a whole new role, but it's still important to keep that connection with your partner. Try reconnecting without the baby, with that babysitter, like having a dinner together or going for a long walk. Make sure you get as much rest as you can and that you're both taking care of yourself. And don't forget to compliment your partner on why you're attracted to them. And engage in non-erotic touch, like a back rub. This can relieve stress and maintain a good connection.
I like that, a back rub. Very nice. Okay.
She gets it. She's not giving one. She just gave birth.
Okay.
Yeah, she just gave birth. So yeah, back rubs for her.
Oh, okay. Well, the guy goes through some stress too, you know.
Okay.
Our next question. My doctor says I need to have a testicle removed. How will this affect my sex life?
For most men, the removal of one testicle, which is a procedure known as orchiectomy, has a minimal impact on their ability to have an erection or engage in sexual activity.
And Dr. Leah, tell us why that is.
The remaining testicle often compensates by producing more testosterone and sperm. This means that your body can maintain normal levels of these crucial hormones in cells, ensuring that your sexual function remains largely unaffected. And if there are side effects, they're usually temporary from the surgery. This includes fatigue or sickness, which can lower your sex drive. These effects typically go away as your body recovers from the surgery.
Okay, so that's -1. So what if there's -2?
Well, this is rarer, but the impact can be more significant. With both testicles removed, your body will no longer produce testosterone naturally, which is vital for maintaining sex drive and the ability to achieve an erection. The good news is that your doctor can prescribe testosterone supplements to help restore your sex drive and your ability to get an erection. These supplements come in different forms, including injections, patches, and gels, and they can help manage the symptoms of low testosterone.
You know, I'm putting myself in that position. For a man, it's got to be the psychological impact to this, isn't there?
Absolutely. Feelings of anxiety, depression, or reduced self-esteem are common. Talk to a mental health care professional or join a support group, which can help provide you with coping strategies and proper emotional support. Just remember that the removal of one testicle usually does not significantly impact sexual function. Get the care you need, and you should be able to maintain a fulfilling sex life. This procedure to remove a testicle is usually done to prevent testicular cancer. For a little more insight, a doctor answers some frequently asked questions.
Testicular cancer typically affects younger men, although there's a peak in the teens, 20s, and 30s, and there's another peak actually in the 50s and 60s. When I meet with a young man, often they have this perception that cancer only occurs in old people, and they may even feel guilty about having had a delay in diagnosis. Sometimes they had a feeling that they might have testicular cancer, and they were so anxious and concerned about what was going to happen to them from a body image standpoint, from a fertility standpoint, from a am I going to die from this disease standpoint, that they're paralyzed and have a difficult time coming in, or they delay diagnosis because they're in denial. The fact that actually testicular cancer is the most common solid tumor in young men, and that there is this highest peak in the teens, 20s, and 30s, although there is this second peak in the 50s and 60s. There is an association between lower fertility and testicular cancer, but we do a lot with men around the time of the initial diagnosis to make sure that we do everything we can to preserve their fertility. And thankfully, most men are able to have children after testicular cancer therapy, either on their own or with assisted reproductive techniques. But we do everything we can, and thankfully, most of the time we can preserve fertility for men after treatment for testicular cancer. Testicles are ornamental. They hang outside the body. We know they're there, or we can see them in the mirror. Other people can see them if we're walking around the gym and our towel falls down. What I remind men is that when we remove the testicle, we leave the scrotum exactly where it is. And a man in a gym that loses their towel is not going to be recognizable as having one testicle versus two from across the room. The ornamental aspect is usually not a big concern for men. Obviously, some men are worried about their body image, about how they're going to feel, about how they're going to look. And thankfully, for men that do have concerns about that, we can put in a fake testicle, a prosthesis. And that's indistinguishable for most people from the testicle that was lost.
Let's take another question from one of our viewers. I got BV after having sex with my long-term partner. Does this mean they are cheating on me, Dr. Leah?
Bacterial vaginosis is a common vaginal infection caused by an imbalance in the vaginal microbiome. Unlike sexually transmitted infections, BV is not necessarily related to sexual activity and can occur due to a variety of factors. So no, BV is not a definitive sign of infidelity.
Okay, so what causes it?
Having multiple partners can increase the risk, but it isn't the only cause. Douching can lead to BV. It can disrupt the natural balance of the bacteria in the vagina. Smoking can also contribute to BV, since it might cause some changes in the vaginal flora. And your body chemistry matters too. Sometimes your body's natural reaction to your partner's semen or their genital yeast and bacteria can trigger BV.
So what are some of the symptoms to look out for?
Some BV symptoms are vaginal odor, discharge, and discomfort. Some women may have symptoms and some may be asymptomatic. Either way, it would still require treatment.
And how is it treated?
BV can sometimes resolve on its own within a few days. However, some cases may require treatment, which can last for a week or longer. It's important to take the full course of the treatment to effectively clear the infection. Research suggests that people who continue to have sex with the same partner before and after treatment may experience recurring infections. This can be due to the constant exchange of bacteria between partners. If BV reoccurs, you need to talk to your doctor. Take those antibiotics.
There you go. So it's a good thing to know that's not necessarily being cheated on. If you
No.
like that. Okay, that's good. That
Although it is, like I said, more likely to happen if somebody has had multiple partners, but it can happen to somebody that's completely abstinent.
Okay, good to know. Next question, Dr. Leah. A viewer asks, if my husband struggles with ED, will we struggle with infertility?
There are a few things to consider. First of all, a lot of factors play into ED. Plus, different treatments have different effects. When it comes to pills like the PDE5 inhibitors, those are typically considered safe when trying to conceive. An analysis of 11 studies involving over 1,000 male subjects found that PDE5 inhibitors increase the number of motile and normally shaped sperm, which is essential and effective for fertilization. But these medications must be used properly, otherwise they will have the opposite effect.
You know, the first thing that came into my mind when I read the question is testosterone therapy. Is that an option?
Well, testosterone therapy is often prescribed to improve sexual function, but it can negatively impact fertility. This is because testosterone supplementation can disrupt the natural balance of hormones involved in sperm production. While testosterone may enhance libido and erectile function, it can reduce sperm count and quality by suppressing the production of the gonadotropins, hormones which are crucial for sperm production.
Okay, so if you're planning on having a family, you want to maybe eliminate the testosterone therapy if that's where you're on, so you're more fertile.
Yeah, so, and there's also things that you can do like HCG, which then supplement your body's natural testosterone. So sometimes when people are on testosterone therapy, they'll also be on HCG. So testosterone therapy is triggering your body to the uptake. It's saying, we have enough testosterone, we don't need to produce anymore. So a lot of times they'll also prescribe HCG injections, which will then tell your body, keep producing natural testosterone. But typically, if you're trying to conceive, they'll say, keep with the HCG, go with the testosterone.
Okay, right, okay. And testosterone is something, it's not the 1 or 2 times you have to use this. Once you start, you have to continue using it for as long as you want to.
As long as you want the desired results, yeah. I mean, you can stop it. It's not like you're going to experience withdrawal or anything, but if you want the desired results.
You have to stay on it, okay, good.
Yeah.
All right, I think our last question of the day,
All
Dr. Leah. Ready? Here we go. A viewer says, a viewer asks, is there a way to get my wife to be more enthusiastic about oral sex?
Let's start with your approach. One of the best ways to encourage your partner to engage in oral sex is to initiate it yourself. Start by giving her oral sex, but don't view it as a chore or a means to an end. Instead, genuinely enjoy the process and explore new ways to pleasure her with your fingers and mouth. Showing enthusiasm and care can create a reciprocal desire. Respect her boundaries and moods. There may be times when she feels like she's just not in the mood or feels too tired, and pressuring her to give you oral sex can turn it into a negative experience, causing her to dread it and rather not to look forward to it. Always ensure that it's consensual and an enjoyable act for both of you.
So in other words, communicate. Make sure that, okay.
Always, right? During foreplay, express what you enjoy and what you would like her to do. Whispering your desires and kissing passionately can set the mood. If she hasn't performed oral sex on you, it may be because she's unsure of how to proceed. You can gently guide her and explain to her how you like it, making the experience a shared journey of discovery.
Very nice.
Well, Derek, that was another great program. I loved answering all of these questions. We're out of time, but we'll see you next time on our Sex Talk program where we answer the questions you've always wanted to ask.